imagine you're a global health leader, okay? And maybe you're facing some new emerging health crisis. Think like a mysterious new dengue strain spreading fast.
Yeah.
Or maybe it's simpler, you're just trying to figure out why one town has way higher rates of, say, diabetes than the next town over. Where do you even begin? How do you make those big calls, the ones that could literally save lives, and shape a whole population's future? Well, it all boils down to something often working behind the scenes: information. Health information. Today on the deep dive, we're really pulling back the curtain on the incredible power of this health information. We're going to trace how data travels from maybe a single patient record all the way up to these huge global health goals. And we'll uncover how it fundamentally shapes our understanding, our policies, and, well, ultimately our lives. So on mission today, let's unpack the critical role of these vast health information systems. We'll explore the super diverse sources that feed them, some might surprise you, and then see how it all comes together in these ambitious global efforts like the Millennium Development Goals. Get ready for some aha moments, hopefully, connecting the dots between maybe your last doctor's visit and worldwide well-being. So let's start right at the beginning. What exactly do we mean by health information? It sounds simple, right? But our sources show it's actually far more complex than just counting sick people. It's defined as this comprehensive mechanism for, well, collecting, processing, analyzing, and transmitting all sorts of health-related data.
And what's really crucial there is the purpose. This isn't just collecting numbers for fun. Think of it like the central nervous system for healthcare.
Yeah.
It's absolutely essential for organizing things, operating health services at every level, local clinics, regional hospitals, national ministries, you name it. And beyond just running things day to day, it fuels vital research and training for new health professionals too. But here's the kicker. For it to actually work, for management, that information has to be, well, reliable, relevant, up to date. Adequate, timely, and reasonably complete. If it's missing those qualities, it's just noise, really, not insight.
That makes total sense. Like garbage in, garbage out, right?
Exactly.
So if that's what it is, what are the main goals? Why gather all this info? What problems is it trying to solve?
Ultimately, it's about empowering the people making decisions. The main objectives are providing solid info for health managers, serving educational purposes, both for the public and for professionals, and keeping a constant eye on how health services are actually performing, monitoring them. If you zoom out a bit, it's kind of a four-step thing. You collect the raw data, then it gets transmitted, then processed. And finally, and this is key, it's transformed into actionable information. That transformation is where the magic happens. It goes from just numbers to insights you could actually use for planning, improving things, managing health.
Okay, now here's where I think it gets really interesting. What makes a health information system truly effective? Our sources lay out some criteria that are, well, surprisingly imaginative. Some almost sound counterintuitive at first.
Yeah, that's a great point, because just piling up mountains of data isn't the answer. An effective system isn't just about collecting, it's strategic. A key insight here is that it really needs to be problem-oriented. It's not about, grabbing everything possible. It's about getting exactly what you need to tackle a specific health issue and getting that data directly from the target population, avoiding that unnecessary agglomeration of data they mentioned, because sometimes less, more focused data is actually, well, more powerful, easier to make sense of.
Wait, avoiding unnecessary agglomeration? That does sound counterintuitive. Isn't more data always better? Especially for a deep dive like this, what's the risk?
That's a fair question. It really boils down to efficiency. If you collect too much, or stuff that isn't relevant, it can just swamp the system. It makes it slow, expensive, and really hard to pull out the important insights. You end up with a data storage headache, not an information solution. So an effective system also needs to use functional, operational items you can actually measure easily, like episodes of illness or specific lab test results, things that are concrete. And this next point is brilliant for clarity. Information should be expressed briefly and imaginatively, using more pictures than tables even.
More pictures than tables. I love that. That's a great takeaway for anyone trying to communicate complex stuff.
Isn't it? It really helps understanding. And finally, it absolutely must include a way to get feedback from people about their opinions on the health services. You need that human element. Patient satisfaction can't get lost in the number.
That keeps it grounded in real experience. So considering all that, what kind of information do these systems need to collect? It sounds incredibly broad if you want to meet all those goals.
Oh, it is. It's definitely comprehensive. To get that whole picture of health, you need demography and vital events. Things like birth rates, death rates, marriage rates. Gives you a snapshot of the population structure. Then there are environmental conditions. Crucial stuff like air quality, water, soil conditions, noise levels, even radiation. It's about the actual context people live in, you know?
The environment they breathe and live in, literally.
Exactly. And beyond that, you need to understand health status itself. That covers morbidity, the rate of disease, mortality, the death rate, disability, and even things like quality of life measures, which can be more subjective. We also need data on health resources, how many hospitals, clinics, beds, doctors, nurses are actually available. And critically, you track utilization and non-utilization of health services. Who's showing up? Who isn't? What are waiting lists like? And it doesn't stop there. You have to assess the outcome of those services. Are they actually making people healthier? And finally, yes, financial statistics. What does it all cost? What's being spent?
Wow. That is an astonishingly comprehensive list. It's crystal clear this isn't just about tracking diseases. It's about painting this truly holistic picture environment, cost, satisfaction, the works. So with this huge range of information needed, you must be wondering, where does it all actually come from? The lifeblood is often routine health stats, sure, but the real sources are incredibly varied, sometimes quite surprising, actually.
Yeah, the diversity is key here. A fundamental starting point, usually every 10 years, is the census. It gathers that essential demographic, economic, social data.
Yeah.
It's invaluable, but
It takes a while to get the full results, doesn't it?
that's the known challenge, yes. That's not fast. So in some big countries, like India, for example, you also have independent things like the National Sample Survey. They do population surveys specifically between census years. Very useful. Then you have ongoing registrations, births, deaths, marriages, that give you fundamental demographic data much closer to real time. Ad hoc demographic studies can fill specific gaps, maybe looking at migration or a particular community's health. And a major source, obviously, is reports of health and disease. This includes the mandatory stuff, like notifications of certain communicable diseases to the WHO under the international health regulations, think cholera, plague, yellow fever, and also diseases under international surveillance, malaria, polio, influenza. These rules help prevent global spread.
So that's the infectious disease tracking. What else?
Well, hospital records and registers from clinics and hospitals provide detailed data on diagnosis, treatment. But you have to be careful, right? This data only covers people who actually sought care. It might not represent everyone.
Good point. Skewed towards those who access services.
Exactly. Then you get specific data from disease-specific programs, like HIV or STD surveillance. They often track behavior trends, too. And on the environmental side, you've got schemes measuring radiation, dust, pollutants. That's vital environmental data. Ideally, it all gets pulled together. Don't forget health manpower statistics. Knowing how many doctors, nurses, etc. are available is crucial for planning resources.
Makes sense. You need to know who's there to provide the care.
Right. And even broader economic data consumption, employment rates,
Yeah.
income that sheds light on population health, too. But here's a fascinating one, often overlooked. Data from social insurance schemes.
Oh, like health insurance data?
Sort of, yeah. Often linked to employment. Think sickness benefits, disability claims.
Mhm.
This data tends to be incredibly rigid and unambiguously recorded. Why? Because money's involved.
The financial incentive for accuracy.
Precisely. People are making claims, requiring detailed documentation. So it's exceptionally reliable for studying things like sickness absenteeism. And finally, you have various surveys, health interviews, health examinations, health record surveys. These dig into specific problems, service use, maybe public perception, unmet needs, give you a clearer picture sometimes.
That is just an incredible mosaic of data points coming from everywhere. It's amazing it all comes together. And beyond the national level, the WHO plays a massive role, right, in pulling this together globally.
Absolutely. They consolidate and share this information. They publish things like the weekly epidemiological record, World Health Statistics quarterly, the annual, and crucially, the International Classification of Diseases, the ICD.
Ah, yes, the ICD. That's huge, isn't it?
It's a total game changer. It's basically a universal language for coding health conditions. It lets every country, essentially, speak the same data language. That standardization is absolutely vital for comparing health across borders, tracking global trends.
Without it comparing apples and oranges, basically.
Pretty much. It would be nearly impossible otherwise.
Okay. The sheer number and variety of these sources really hammers home how complex building this comprehensive health picture is. It's staggering, but it underpins everything. So we've talked about what health information is and where it all comes from. Now, the big question, what's it actually for? How does all this data get put to work to, improve health on the ground?
Well, thinking about the practical impact, the applications are really critical. This information is used to properly measure the health status of people, to quantify their specific health problems, their healthcare needs. It lets you make comparisons local, national, even international. Though, as we just said with the ICD, for those comparisons to mean anything, you need rigorous standardization and quality control.
Right. Got to compare like with like.
Exactly. This data helps us figure out healthcare needs, identify priorities, where should we focus efforts. It's fundamental for planning effectively, for administration, for managing services day to day. It lets us check if health services are actually achieving their goals. Are they effective? Are they efficient? And beyond the hard numbers, it helps gauge attitudes, beneficiary satisfaction with the health system. And ultimately, it's a massive resource for research and education. It shapes policy and public understanding.
You mentioned one source earlier that really stands out for precision, health insurance data. What makes that type of information so uniquely valuable, almost like a gold standard in some ways?
Yeah, what's striking about health insurance data, often linked to those social insurance schemes we talked about, is its incredible reliability for looking at illness occurrence, even prognosis, within the insured group. The reason it's so solid is that every illness episode tends to be, as the sources say, rigidly and unambiguously recorded.
Because of the money trail again.
Largely, yes. Monetary compensation is usually involved. Claims require meticulous documentation. So this data is exceptionally useful for studying things like sickness absenteeism patterns. It gives employers, public health officials clear, actionable insights into workforce health. For instance, in India, there's the Employees State Insurance Scheme, ESIS. It provides care for workers and their families. That generates this really rich, consistent data pool over time. And this kind of granular data, combined with everything else, provides that crucial foundation for the big global health initiatives. It's a great example of detailed data fueling big picture impact.
Okay, let's make that connection now to the bigger picture.
Mm.
All this incredibly detailed information, it feeds into these massive global efforts to improve health, and the Millennium Development Goals, the MDGs, were just a colossal step in that direction, weren't they? A real turning point.
Yes, and it raises that powerful point about global accountability. The MDGs weren't just nice ideas, they were specific commitments adopted by the UN General Assembly back in September 2000 at the Millennium Summit. World leaders actually made concrete promises for development, for poverty eradication, with clear, measurable targets. The deadline was 2015. And what's really fascinating is how strategically they put health right at the heart of development. These goals weren't solely about healthcare, they were broader. Reducing poverty, hunger, tackling ill health, gender inequality, lack of education, access to clean water, environmental issues.
So seeing health is connected to everything else.
Exactly. They basically served as a practical roadmap for putting the UN Millennium Declaration into action. And they forced countries to collect and analyze the very health information we've been discussing, specifically to track their progress against these goals.
It's pretty remarkable how central health was woven into the fabric of global development, not just treated as some separate silo.
Absolutely. I mean, just to give you a sense, 3 of the 8 main MDGs were directly health-related. But it goes deeper. All the other goals had significant indirect effects on health. They recognize that things like education, equality, clean water, they're all tied to well-being. Specifically, if you look at the targets and indicators used to measure progress, 8 out of 18 targets and 18 out of 48 indicators were explicitly health-related.
Wow, so health really was a cornerstone of the whole framework.
Definitely.
Okay, let's dive into some of those specific health goals then. What were the actual targets they were aiming for? How did they track progress?
Sure. So goal 1 was eradicate extreme poverty and hunger. Now, the health indicators here really get to basics of well-being. They track things like the prevalence of underweight children, under 500 millions, a direct measure of childhood malnutrition, and also the proportion of the population below the minimum level of dietary energy consumption. Basically, are people getting enough food?
Really fundamental stuff.
Totally. Then goal 4, reduce child mortality. This was ambitious. Reduce child mortality by 2/3 between 1990 and 2015. Key indicators were the under 5 mortality rate, infant mortality rate, and the proportion of 1-year-olds immunized against measles. A simple, powerful measure of health system reach. Goal 5 focused on improving maternal health. Here, they tracked the maternal mortality ratio deaths per 100,000 live birth and the proportion of birth attended by skilled health personnel. Access to safe childbirth, essentially.
Critical indicators for women's health.
Absolutely. And finally, goal 6 was combat HIV/AIDS, malaria, and other diseases. This had broad indicators: HIV prevalence in young people, condom use rates, number of children orphaned by AIDS, prevalence and death rates for malaria, use of prevention like bed nets, prevalence and death rates for TB, a whole range looking at major infectious diseases.
So these weren't just aspirational words on paper, they had real impact by setting clear benchmarks, focusing global attention, driving action, and presumably funding.
Precisely. The MDGs were really instrumental. They helped countries develop national policies that specifically focused on the poor, the most vulnerable. And crucially, they provided that framework for robust data collection and analysis we talk about. It allowed nations, international bodies, everyone to track performance of health programs and systems globally. That accountability, driven by specific, comparable data, that was a game changer for development.
And these goals evolved, right? They didn't
Yeah.
just stop in 2015.
That's right. If we connect this to how global health thinking evolved, the MDGs were succeeded by the Sustainable Development Goals, the SDGs, adopted in September 2015. The SDGs didn't just throw out the MDG framework, they built on it. They kept and expanded key health targets: maternal mortality, child mortality, infectious diseases. But they also brought in vital new areas, reflecting, an evolving understanding. Things like neonatal mortality, hepatitis, waterborne diseases, and targets on universal access to sexual and reproductive health care, access to vaccines and medicines. Those are also closely related, building on that MDG groundwork. It shows this continuous data-driven effort to refine global health goals.
And just like that, wow, we've journeyed from the basic definition, the incredibly diverse sources of health information, seen its practical uses in measuring health and planning services, understood the unique precision you can get from, say, health insurance data, and finally witnessed its powerful role in shaping these huge global initiatives like the MDGs and now the SDGs. It really is a testament to how crucial every single piece of data is, isn't it? From that one individual record right up to the global ledger.
It really is. It just underscores that deep connection between good information, sound policy, and ultimately improving global well-being. Data isn't just numbers, it truly is the foundation for progress.
So here's something to think about as we wrap up. As we face all these new challenges, climate change affecting health, future pandemics, AI, and diagnostics, how do you think current global health initiatives, building on the MDGs and SDGs, are using these increasingly sophisticated health information systems? How are they leveraging them to tackle these emerging threats? And maybe even what entirely new types of data, things we can barely imagine today, might become absolutely crucial for public health in the next decade? Something for you to chew on until our next deep dive.